Hello everyone, welcome back. Today I'm going to speak to you about one of the most annoying noises you'll ever hear from your child, teeth grinding. I will be discussing what causes teeth grinding, how to address teeth grinding, and last, when you should definitely visit the pediatric dentist about your child's teeth grinding habits. Let me share the good news. It's pretty common. About 30% of children grind their teeth. And yes, the sound is really loud and unnerving, especially if it's all through the night, but it's actually completely normal as your child transitions from baby teeth to permanent teeth and as their teeth and jaw placement changes. The good news also, it dramatically decreases as adult teeth erupt at around 6 years of age. So teeth grinding can be caused by airway issues associated with nasal patency and mouth breathing, and also a moderate to severe tongue tie. Also, night bruxism, meaning clenching at night, can definitely be a way of your brain signaling to your mouth muscles to change position of the jaw and the teeth to allow better breathing at night, especially when you have big tonsils, big adenoids, or your tongue that's obstructing the airflow. In younger children, bruxism can be caused by the masticatory system, which is the chewing, neuromuscular system, being immature and not developed yet. In addition, children under 6 years of age can have teeth grinding from teething, from misalignment of teeth and misalignment of their bite, and also ear infections. Emotional stress or anxiety can definitely cause teeth grinding, especially in school-aged children. In addition, sleep disturbances through the night is another factor that can cause tooth grinding. And the point is, there's a lot of research that still needs to be done, but definitely all these factors play a role in teeth grinding. So what can you do about your child's teeth grinding habit? 1, you can develop a pre-bedtime routine that's relaxing. So avoid cold showers right before bedtime or loud music, any triggers really. Especially iPads and phones, that bright lights tends to excite neurons and just brain activity. So you really want to avoid doing that. 2, stress management. Find out what your child is stressed out about. What is it that they're going in school that is really stressing them out? And help them address it. Really having a hobby after school or finding a time for leisure and exercise can really help your child's overall well-being and their grinding habit. Last but not least, breaking the habit, especially if they're doing it during the day, is very important. For younger ones, you can introduce teethers. That oral stimulation can help break the habit. And for older ones, chewing gum is actually great. But remember, it has to be sugarless gum. When should you see the pediatric dentist when your child is grinding their teeth? 1, if their child is complaining of tooth sensitivity to hot or cold, that's a sign. If they're eating ice cream and you see a change in facial expression, there's definitely tooth sensitivity there. If your child has fractured teeth or broken teeth, or even their teeth are wiggly and it seems to be too early, take them to the pediatric dentist. Also, if you see a pink shadow over the tooth, it can be the nerve actually being exposed from all the grinding. In addition, if your child is snoring through the night and they're not sleeping through the night and they have sleep disturbances, that, in addition to grinding, and if they're a mouth breather, is definitely a cue and a sign to see your pediatric dentist and to discuss this. I hope this helps. I try to answer all the frequently asked questions my patients always ask. If you have any more questions, feel free to drop them in the comments below. Thank you.